In Uganda, when a woman is happy, they laugh loud. Happiness spreads around. The home rings and vibrates and lives. So we do well to invest in a woman. Let the woman live.
Cervical cancer is the most common cancer in sub-Saharan Africa.
Cervical cancer is higher than breast cancer in Uganda, as opposed to the developed countries actually where it's the reverse.
In Uganda, it is the leading cause of death amongst all cancers.
It accounts for 40% of the cancers we have in Uganda, so that's really high.
Although we have a high burden of cancer of the cervix, we are not screening.
So we miss an opportunity to treat the precancerous lesions and only see the women when they are full invasive cancer.
Cervical cancer can be put into about the precancerous stage, but also into stage 1, 2, 3, and 4. Most of the patients we see are in stage 3 and 4.
Nobeera n'abaana kati wali okola kyalo bwemera
nga nnima bulimi mpakasa
ng'opakasa
mperera omwana
bambe
kinuma nnyo nga kisimba mu muntu mulala nga sina kye mmanyiisawo kaakati ne ŋŋamba taati yavaayo nga nange obulwadde bunkutte
yali asoma kyakumeka
yali asoma kya musanvu.
It's really hard to watch someone dying, especially when you take this person to the hospital and they say they can't really do much. You've brought someone too late in the last stage.
We are trying to catch them early so that they don't even reach the stage where they can get cervical cancer. And if you catch them early, they will live.
If we can emancipate the women, the children are likely to survive, and the husband is likely to be fine, and basically means the communities live and the country does better.
Omugaso gw'omukyala awaka bw'aba nga yalwadde amaka gakosebwa nnyo kubanga omukyala yatambulirako byonna yenna muziga buli kimu kitambulira ku mukyala abaana omwami famire yonna okwetooloola.
Majority of the agricultural produce in Uganda, 80% is by women. So mothers are so central, both in the culture, in the socio-economic, everything. They are so important to the society in Uganda.
What I tell people that Aspire is about is an option for HPV self-collection in low-resource settings, specifically in Uganda, where women don't have access to screening, partly because there's no infrastructure in the country for a cytology or a pap smear-based screening. How we started things was with a community engagement workshop. And the women who were invited to that were definitely women who had been involved in previous iterations of the project. What we really tried to do is contact different chairpersons for each of the sub-villages, and they also got to select some women who they thought would be both good advocates for women's health and who may have had a personal interest in it as well.
The women are key in our project because we believe they are going to talk to each other, advise each other. In a way, it allows us to see where these women come from, to understand their living conditions, to understand what it is that they want, and to be able to adjust our program to fit in their needs.
Bantu bakaita human papillomavirus.
The day was fantastic because the women were open. We explained to them what we wanted to do. Because I remember when we talked about the speculum, they said, no way, you can't put that in us. But when we said you are going to be in control of collection of your own specimen, they clapped, which shows, that was a breakthrough in getting them to be tested.
The most important part of any type of engagement strategy is engaging community leaders. And I think for Aspire, they really struck it lucky when they got Veronica involved. She's at the very heart of the Aspire project.
We are elected. I'm elected the chairperson from 1986. When Sona came, it has to come to me first. You have to look for a local council first. That's how Uganda we are. We believe in those local people.
In the process, we use those women as contacts. So each day over the course of 3 to 4 weeks, Veronica would choose a specific area and start with a woman who she knew was interested in doing self-collection, who may have attended the workshop. And from that, it was incredibly easy to get the rest of the women that we would recruit for that day.
We went house to house looking for women above 30 years, asking them, did they know really about this cancer of the cervix? Not all women knew about that cancer, but they were eager to know about it.
I think for me, Veronica represents all the women in Kisenyi, and for anyone who's involved in this project, that is absolutely their motivation, is individual women who don't have access to screening, not because they're lazy, not because they don't care about their health, but it's often because they don't know that they need to be screened and they don't have access to the infrastructure for screening as a result of poverty.
This project, they like it. They like it very much. First thing, our women here in Kisenyi, they don't have time to go to hospital. So when somebody brings that thing at home, they just feel nice.
Boyankebera na malaya akasera katono na komao nangamba olina okugenda lwali lunaku lwokusatu olina okugenda emulago bagende bakukebere.
My doctor, Dr. Sean, happened to appear to my home and I was given that swab and I tested myself.
We know that HPV self-collection is a feasible way to screen for cervical cancer. We know that from studies that have been done in hard-to-reach women and in low-resource settings. But many of those studies look at women who they come to a health clinic and then they do their own self-collection there. And so there's few projects that actually focus on women collecting their own specimens just in their house or at work even. And so I think that in the way that it is taking down all these systemic barriers for a woman accessing this screening, I think really that's what sets Aspire apart from other approaches to cervical cancer screening.
Talking with women, for me, it is very easy. First of all, you have to look yourself as she is. Be as her.
Nyabo nsanyusa okulaba.
Kale nyabo.
Sanyu tulabira wa.
Kale nyabo.
Munnaye nga nsanyusa okulaba.
Nyabo.
Eradde mama.
Jebaleko nyabo.
Kale nyabo.
Nyabo nvudde Makerere. Spelling project. Nga tuli bakyala abanoonyereza abakyala akawuka akaleeta kansa w'abakyala n'abaana.
Nyabo.
Nyabo kati kyekindi.
Nsanyusa okulaba.
Kale nyabo.
Jangu tuyinga.
The fact that the women are participating in taking their own samples and determining their health makes it easy for the women or the communities to own this program.
Nedda nyabo. Ati bw'omaliriza nnyabo ng'omala ng'osumula amazzi gano tugaagala nnyo gano tegavaamu ng'osumula akantu kano ng'oteekamu kati wano olaba wano w'omenyera wano n'okasaanikira bulungi n'okandeetera
akatondo n'enkasuulayo
katondo n'okasuula kati maama kano kange kati ngenda kukuba kano akapya tugenda.
And then she goes behind a curtain or goes to the latrine and self-collects the sample, brings it back to the research assistant. That was how the recruitment process worked.
Having women like Veronica reduces the barriers. A woman will fear to challenge me because in my white coat, looking like a high priest and telling them go and test yourself, I may look threatening to the women. Whereas someone in the community may sit and they say, Veronica, tell me, do you think this will work? Someone they know, someone they talk with, they've lived with, who says I've also done this to myself is more convincing. The power of peer, as you know, is very great in getting treatment moving.
New screening technologies are very welcome to a developing country like Uganda. So of course, if we could have an effective screening program, especially with the effective diagnostic techniques like HPV DNA, that would be very excellent. So we welcome it in this country.
It's a new technology that is being tested. It is basically a HPV DNA test and has got a number of advantages compared to the other methods that we currently have. If you talk about pap smear, VIA.
So if you have this simple test, it doesn't really need highly trained people to run it.
Even if you looked at training a lab technician, somebody that can read a pap smear, this may take 2 years, and for somebody to really become thorough in reading it, even more time of working. Our lab technicians who already could do other lab tests, within 2 weeks they were thorough.
It has the advantage of mass screening, community screening. The other advantage is that it doesn't need a full-fledged lab. You just need a small desktop to basically work from.
These tests can be carried out almost in any setting. Even in our setups where we don't have a lot of water running, we don't have electricity at times.
Early diagnosis through a method like this allows intervention to be timely and therefore much cheaper to undertake.
Essanyu lijja kunkwatirawo kubanga nja kuba ntegedde ki ekivuddemu. Sinaawo ttamu. Thank you. Kulira bulungi. It is least kubanga mbadde ntya nnyo naye at least.
I had a call and they told me I have HPV. I would not believe it. I felt that it was the end of the world to me. But eventually the people who broke that news to me, they tried to comfort me, and eventually I became strong.
What makes me happy is when I see someone who has come in with early lesions and then we treat them. At the end of the time when she comes back for follow-up when she has healed, I go back home when I know I've done my work. It gives me joy. I know that at least I've been able to save someone.
In cryotherapy, we are just applying nitrous oxide gas at a very low temperature to the cervix. Cryotherapy is a simple outpatient procedure. You don't even need a trained doctor. We can train our midwives, and any health worker can do it.
It's a very portable machine. Does not need a lot of technology. Doesn't need power. Once they train someone, it's a matter of her sitting and then she starts. Because you're not going to use force, it's very gentle.
After the news, we were told to go to Mulago Hospital, so I had further checkup.
After counseling, that's when they start gaining confidence. We treat them, then we are like, you are done, you're okay. They go back when they are so happy.
She'll jump up in the sky. She'll pray for you because she knows you've helped her a lot because of something she didn't know.
Actually, after the results, they told me that I had no any problem. I was so happy. You can't imagine. I was the happiest person. Yeah.
We need to create more awareness by educating the community people, the health workers, so they spread the gospel.
That's very true. When people receive good service and it is useful, they get cured or the disease is prevented. They become change agents in the society. So if women came and they were screened, they would definitely go back and be change agents and be able to advocate for screening, especially coming early.
A woman who is educated can easily go for screening, and you know, when the children also see that the mother is going for regular screening, the children are also likely to know it from very early stages. So it is good that we can actually target the women as well.
After you have treated her, you tell her, please go and save another person.
Ekirungi nnyo era mbakubiriza okulaba nti basobola okwekebeza. Haliwo omukyala munaffe wano nze muyamba okumusuza naye ayagala okumukeberako.
My humble request is to kick cervical cancer out of Uganda. It should go far. I don't know where it should go. It should leave us, and people can live their normal life because it is a threat. We've lost so many loved ones, so many friends.
I can tell you that I am very hopeful about the future. We have a lot of resources in the country, so if they are well utilized, Uganda can definitely be much better and shine.
There is an opportunity for Uganda to lead. What I would like to see in the future is a screening that is targeting the low-resource communities. Those are the bulk of our patients in the hospital who come in with cancer cervix.
I want it to be one of our services also. If I had someone to help me to introduce this cancer screening system in my health center, I would be very grateful because many things would have happened, saving the child's life, the mother's life, even the husband.
Yeah, I would like to see that the start begins from Kisenyi, then to the other parts of the country.
I mean, I think if anything, there's no question that women are willing to participate. The technology is there to do it. There's so many things that were previously barriers that we're seeing now melting away. It almost sounds too good to be true, but it is actually a feasible method to move forward with.
It will be a great help to the nation.
There are many reasons why mothers should leave. Children need love from mothers. If mother is not there, you can't get that love.
So when a mother leaves and can tell the story, what it will do is beyond our imagination now, because it will have removed the veil of hopelessness.
When a mother lives, the whole house is at peace. Everybody is happy. The kids are going to school. They study and have a good future.
When a mother survives, the country is likely to develop. And this is in all aspects of reproductive health.
She's able to live her normal life. She can bring up her children the way she wanted, and the children can live to see her again because she's alive.
Since most of our economic development is supported by women, there are benefits to the family, there are benefits to the community, and there are also benefits to the nation.
If a mother lives, then the nation lives. It's a very good title.
We're seeing in more and more developing countries that the most successful health interventions, as well as the most sustainable, are the simplest. And that's exactly what Aspire is all about.
Aspire is a very good idea, and good ideas shouldn't remain covered up in a box.
We are all fighting the same disease. Go and save as many as you can. That is my humble prayer.
If there is a big project, I'm ready, ever ready.